And most importantly of all, the top priority the President gave us, to work with members of Congress and make sure that the Obamacare nightmare is about to end. I'll tell you, it's amazing to think about. I mean, virtually every promise of Obamacare has been broken. We all remember the promises that they made back in 2010 when this was signed into law. They told us the cost of health insurance would go down. Not true. They told us if you liked your doctors, you could keep them. Not true. They told us if you liked your health plan, you could keep it. Not true. Here are the heartbreaking facts. Today, Americans are paying $3,000 more a year on average for health insurance than the day Obamacare was signed into law. Last year alone, premiums spiked by 25%, and millions of Americans have lost their health insurance plans and lost their doctors. And in 1/3 of the nation's counties, Americans only have one insurance company to choose from, which essentially means they have no choice at all. The truth is the American people are struggling under Obamacare every day. And so are small businesses like those so well represented here. You all know exactly what I'm talking about. The truth is Kentucky is a textbook example of Obamacare's failures. Here in the Blue Cross state, premiums skyrocketed by an average of 24% last year, with some plans spiking by 47%. Nearly half of the state has only one health insurer to choose from. And next year, Humana, headquartered right here in Louisville, is pulling out of Kentucky's Obamacare exchange. Today, 1/3 of the state is on Medicaid. And as your governor has said over and over again, it's unsustainable. And Medicaid here in Kentucky is threatening to bankrupt this state. Folks, this just can't continue. And I promise you, it won't. Since the day that Kentucky helped send President Trump to the White House, his top priority has been to repeal and replace Obamacare with something that actually works. And we've already made incredible progress. The House released its repeal and replace bill on Monday, and it already passed with unanimous support from 2 committees in the Congress, one of which Congressman Guthrie sits on. And Congressman, I just want to thank you for your strong support to repeal and replace Obamacare. Now, I know that not every politician in Kentucky supports our plan to repeal and replace Obamacare. I know your former Governor Steve Beshear has been defending Obamacare all over America. And he might even have something to say about my visit here today. And I welcome the debate. I really do. Steve Beshear is actually a friend of mine. We worked together while I was governor of Indiana to promote jobs and growth all across Kentuckiana. I'm awful proud of those Ohio River bridges, aren't you? It's a great story about collaboration between our 2 states. The Abraham Lincoln Bridge, the Lewis and Clark Bridge, I believe are going to support economic growth across this region for generations. But your former governor is wrong about Obamacare. Obamacare has failed the people of Kentucky, it's failed the people of America, and Obamacare must go. Now, the plan the President outlined in his joint address to Congress is the plan what we're working on. We're going to repeal and replace Obamacare once and for all, and we're going to replace it with health care reform that will improve the lives of every American and strengthen our economy. The truth is, ordering every American to buy health insurance, whether they wanted it or not, was never the right solution for health care in this country. So we're going to start out. We're going to repeal the mandates and taxes and penalties of Obamacare. We're going to end Obamacare's individual and employer mandates. We're actually going to get rid of more than $500 billion in Obamacare's tax increases. And we're going to give Americans more choices. We'll expand health savings accounts. We'll give Americans a tax credit that will help people buy plans that they need at a price that they can afford. We'll make sure that Americans with pre-existing conditions still have access to the coverage and the care that they need. And to all the parents here, we'll make sure you can keep your kids on your plan until they're 26 years of age. And most significantly, in my view, we'll give states like Kentucky the freedom and flexibility with Medicaid to meet the needs of your most vulnerable in the way that works here in Kentucky.